office bearers of Nutrition Chapter, Dr. Priya and Dr. Sajda. A warm welcome to Srinivasan sir and all other dignitaries, seniors, and who are attending this program. Thank you.
Dr. Riaz.
Okay. Thank you, Dr. Gopi. So, respected chief guest of the day, Sandhya ma'am, senior teachers, Srinivasan sir, and Purushothaman sir, and all the dear friends here, and respected president of the IEP Nutrition Chapter, Dr. Priya, Secretary Dr. Sajida, and all my friends here. And we also have Dr. Rahul, who is the State Nodal Officer for Child Health of Kerala. So welcome, Dr. Rahul also. So today, indeed, is a very important day for us because we are in a great effort to increase or to popularize the mother and baby friendly hospital initiative in our state. We started this initiative. Actually, we revamped this initiative almost 4 years back because, as everyone know, Kerala was the first state to be declared baby-friendly in 1992, and Cochin was the first city. So after long years, we have slipped regarding the breastfeeding rate, both in initiation as well as exclusive breastfeeding. So now for the last 3 or 4 years, we are trying to come up, and we have actually certified around 50 hospitals 2 years back, thanks to the Government of Kerala, Indian Academy of Pediatrics, as well as the National Health Mission. So now we are in a track to initiate the human milk banking facilities or comprehensive lactation centers all over the state, because once we are going for exclusive breastfeeding and promoting breastfeeding without a human milk banking, it is not possible. So today we have one of the pioneers, or I should say crusaders in the field of human milk banking, Dr. Sandhya Katse madam. Madam will tell us how about her journey of making this real in another part of the country. And we also have Dr. Rahul, as I told, who is the state nodal officer for child health, he is actually in his initiative for starting new human milk banks in the state of Kerala. So before Madam's talk, I would like to welcome Dr. Rahul to share with us the Kerala initiative so that Madam will also know where we are now. Over to Dr. Rahul. Thank you all.
Dr. Rahul.
Am I audible?
Yes.
Yes, you are audible.
Yeah, good evening, everyone. Actually, I'm down with the pharyngitis, so I'll keep it very short. So regarding the comprehensive lactational management centers and the breastfeeding promotional activities that the state has taken up over the last few years, I will just give a brief summary of the same. So Kerala currently has 3 centers in public sector where we have comprehensive lactational management centers. So one is at Calicut, second one is at Thrissur. These both are at medical colleges. And the third one, which was the first one to be initiated with the support of NGOs, that is in the General Hospital at Ernakulam. So these are the 3 centers that we have. So all these activities initiated around 2021, but the pace in which it progressed actually was slower because of many issues, one of which is the funding related to NHM from the central part. So now we are in a phase of coming up with 2 more CLMCs, one at Kottayam Medical College and one at Trivandrum Medical College, which will positively happen in this coming financial year. So these are the status of the comprehensive lactation management centers in the state. Apart from this, we will also be coming up with the more lactation management units, which was supposed to be established in all the major district level centers at least by 24-25. But again, these were all linked with these financial issues that the state had to go through in 23-24 and 24-25. But all these activities will be prioritized and focused. That is what we are planning for the coming year. So that is regarding the scenario in the state, in the public sector. Apart from this, in private sector also, we have a breast milk bank at Jubilee Mission Medical College. Okay, thank you, sir.
Thank you,
Okay,
Dr. Apple, for the update. And we will all listen to ma'am and get her advice regarding going forward. So I welcome Dr. Priya, who is the president of Nutrition Chapter, to introduce madam. Over to Priya.
Yes. Yes, it is my pleasure to introduce Professor Sandhya Khatse, who is the Dean of MGM Medical College, Nerul, Navi Mumbai. She was the recipient of 6 gold medals in MBBS examinations and has a total of 41 awards for her outstanding contribution in pediatrics. This includes the Lifetime Achievement Award, MBPC Mumbai, Asia GCC Awards, and Vaidya Ratna Puraskar. She is the Chief Child Health Monitoring Officer under Maharashtra. In national journals. She has
It is
started
breaking.
14 human milk banks in India and abroad. I invite Madam to share her vast experience on human milk banking. I hope the talk will inspire Kerala to set
Priya.
up new human milk banks. Madam, over to you, Madam.
Thank you, Priya and IAB Kerala.
Yes, ma'am. We will. We can go to the presentation. No issues. Okay.
Yeah.
Priya will join back. I think there's a network problem.
Yeah.
Welcome, ma'am.
Yeah. So first of all, at the outset, I would like to thank IAP Kerala, Priya, and the entire team for giving me this opportunity to share my experiences of Human Milk Bank, and greetings to you all from my state, Maharashtra. Good evening to all and a warm welcome to all of you. Next. Next. My journey of starting Milk Bank in India, definitely it was not a very rosy path. I had to face lot of difficulties, lot of problems. But then if all difficulties were known at the outset of a long journey, most of us would never start out at all. And I firmly believe that difficult roads often lead to beautiful destinations. So definitely I had to go through a lot of difficulty, but my beautiful destination was a starting of the Human Milk Bank. Next. We cannot forget the contribution which was done in Maharashtra, in India. That's our Armida Fernandez madam, who started the first human milk bank in Asia at LTMG Sion way back in 27th November 1989. She is our greatest source of inspiration, particularly in Maharashtra and India, for starting all these human milk bank activities. And my tribute and salutations to Madam Fernandez. And I'm very fortunate that the first milk bank which I started at Government Medical College, Grant Medical College, JJ Hospital, was inaugurated by Dr. Armida Fernandez. The granite stone shows her name. And this bank we inaugurated in 2006. Next slide. Again, the inspiration to start a human milk bank or to work. Of course, Fernandez madam had started way back in 1989. But after that, none of the milk bank mushroomed anywhere as such. And when we were students or we were in our early pediatric career, we were not knowing much about the human milk bank and all. Am I audible?
Yes.
Yeah. So these triplets, they were born at Grant Medical College. when I was professor there and handling the NICU. And this mother was admitted because of her triplet status in the ANC ward. And she used to listen to all my breastfeeding lectures, which I used to take for sisters, undergraduates, postgraduates, etc. So this mother then delivered these triplets who were weighing 800, 750 and 650 grams. Now, as such, it is said that breast milk is enough for all the babies, twin can be fed, even triplets you can feed, they say. But however, she had problem for one of the triplets who used to get less milk, and she was very pertinent that she wanted only breast milk to be given to the baby. Now, at that time in Grand Medical College, we did not have any human milk bank. But she told me that, madam, you only say that breast milk is best. You have taught so many people. Now I don't want to give any formula feed. What is the solution for that? Now that made me think what to do for her. Then immediately I went to Sion, which was fortunately near our college. And then I requested Jayashree Monkar madam, can she give me milk donated from the human milk bank? They had a functioning milk bank there. So madam told somebody has to come and get the milk bank in a sterile container properly. If you can make that arrangement, definitely we will provide. So one of these triplets, daily they used to receive the milk from the milk bank from Sion. One of my interns, you know, in medical colleges, we tell all the work to interns. So one of my interns volunteered and he used to bring the milk for this baby. And these baby all they grew with the human milk totally fed by the mother as well as little bit assistance from the human milk bank. And my residents named them Diksha, Divya, Daksha. They have in fact grown along with me, or I should say I have grown along with them. And today they are having such an intact survival, all extreme preterm. But in spite of that, none of them is having any hearing problem, any cerebral palsy, nothing is there. And they're all fit and fine, totally because of the milk from the human milk bank. These are my greatest source of inspiration for all my work for the milk bank, because of them, I got an idea that I must have a milk bank at JJ Hospital, because every time we cannot go and bring it from other hospitals. Next. After starting the milk bank, we got the donation through Rotary Club. But then again, the problem to start the milk bank at Grand Medical College was that the Rotarians told that we will give you the milk bank, but will you be in a position to run the community surrounding the JJ Hospital? Will they be donating the milk? Will there be any problem? But then we took all the challenges. It was really very hard to start a human milk bank there, but somehow we started it in 2006. Because I started the human milk bank, did a good job, little amount of paper articles and all that came. So I was immediately transferred to Pune from the government to do good work at BJ Medical College, Pune. When I went to BJ Medical College in 2008, at that time, the breastfeeding practices at BJ Medical College was not that good. So my advice to all of you is that wherever there is good breastfeeding practices and breastfeeding promotion and early initiation and everything is going on, that is the place where you should start the milk bank. If people are prescribing formula, never ever go for human milk bank, because it will not work properly. So it took me almost 5 years at BJ Medical College to motivate, to train the staff, and I raised the percentage of breastfeeding from 40% to 85% in BJ Medical College. And then in 2012, when I was sure that my breastfeeding practices has improved, I got donation from Bank of Baroda. My dean was very proactive to help me, and we got this donation from Bank of Baroda, and the second human milk bank was started by me at BJ Medical College, Pune. Then I was retired, then I was transferred again. I came to Rajiv Gandhi Medical College as a dean, and there I refurbished the milk bank, which was already existing, because the equipments were all very much bad and they were not functioning properly. So at Rajiv Gandhi Medical College, I got donation from Rotary Club Elegant and I refurbished the milk bank with all complete equipment. Then I joined private medical college as a dean academics at Nagpur at Datta Meghe Medical College, which is in the remote tribal area Vanadongri at Nagpur. And I had to convince the Rotarians that I need a milk bank. And by this time, I was very famous with the Rotarians of all over Maharashtra almost, and they all recognized my work. So then they said that, madam, if you are there at a private institute, we will be ready to donate. Otherwise, we go for only government. So that way, the Human Milk Bank at Vanadongri, it was started in 2022. Because of all this work and recognition, I got an invitation from Singapore, Sri Lanka, and Bangladesh for starting the Human Milk Bank. And Singapore, I go regularly to train their staff for human milk banking. Next. This is the Rajiv Gandhi Medical College Kalwa Milk Bank at Thane, which was refurbished. And I had attended a neonatology conference at Ghent, Belgium, where I met Dr. Mujibur Rahman from Bangladesh. He was highly impressed with all the concept of the milk bank and milk van which we had started. And so he took my address and he came to Thane all the way, visited our milk bank, took all our guidance, and totally every day I used to guide him on mobile, on all the emails and everything. Got him all the quotations and everything. And this, he started the milk bank at ICH Dhaka, Bangladesh, where I was invited for the inaugural function. Next. Now, saving infants with the use of donor human milk, that is a very old practice. It's not very new at all. Our mythology says Devakanandan Gopala was fed by Yashoda, Pannadai fed Dr. Raja Udham Singh. So it's not a new concept at all. The first milk bank was there in UK in 1930, Brazil 1940, but Brazil is one country which we have to appreciate. They have got 386 government milk bank, and Brazil government has shown a statistically significant reduced neonatal and infant mortality rate because of milk bank. The government there says that don't go for ventilators and all those high-tech equipment, but spend for the milk bank so that that takes care of the neonates. This is what the country Brazil has done, and they have got a very good network and chain of human milk bank. In India, first milk bank started in 1989. After that, HIV and all those problems. So again, the milk bank was in the little bit in the back front. Again, in 2000 onwards, KEM Hospital started the second milk bank. Then we got it for the government colleges in JJ. And then one by one, many medical colleges mushroomed. And now in Mumbai only, we have more than around 10 milk banks. Today, more than 650 HMBs are there in the 50 countries. And India right now, as per the HMB data, our association, we have, I think, around 118 milk banks. Next. Most of the milk banks in India, they are through donation, either by Rotary Club or by CSR funding. We got Bank of Baroda to give us from the CSR funding for Pune. Then some NGOs or through government we have in the state of Maharashtra, Rajasthan, Tamil Nadu. And in Hyderabad, there is a charitable foundation which is running very good human milk bank there. Next. Why there is a need, or first of all, why we have to strengthen the breastfeeding? That is something which is very, very important. Though it is said that breastfeeding is best, everybody knows it, and it is the most cost-effective means to save the life of the child. But still, why our breastfeeding rates are not increasing? We have not crossed beyond 42% to 46% somewhere. This is because of our overcrowded government hospitals, where we cannot give attention to the mother, our overburdened healthcare staff. Many hospitals, there are so many deliveries, and the sisters are not in a position to observe the mother, not in a position to advise the mother. We don't have any lack of trained lactation consultants, counselors, etc. in the hospital. There is delay in early initiation of breastfeeding. Many barriers are there for that. Policy is discharged within 48 hours for normal delivery. It is followed in most of the hospitals. In government of Maharashtra, it is the policy. So by the time the mother gets acquainted and by the time she is ready to breastfeed, she is discharged. And because of overcrowding, sometimes they go even within a day, normal deliveries. So we don't know, we do not have any access what is happening. And there is neither milk donation nor collection. Lot of misconceptions is there among the general population, not to feed colostrum, then to give honey as a prelactal feed, and so many things people practice, and nobody is there to rectify it or tell. Promotion and advertisement for breastfeeding, never it is perfect, just like this Juhi Chawla advertising Kesh Kanti with her husband who is bald. So this is something we are not having any promotional activity for the breastfeeding. We have for Zuma Kesarin, we have for Bagpiper, but nobody says about breastfeeding. Then various time constraints are there, and the person who wants to promote breastfeeding should be passionate and they should have a lot of patience. That is not seen in the young doctors nowadays who are not at all ready to speak to the patients, and the patients are also nowadays not ready to listen to anything. So these are certain issues and challenges which has to be tackled when you want to strengthen the breastfeeding practices. And once the breastfeeding practices are strengthened, then the milk bank donation, everything goes very smoothly. Next slide. The success of a milk bank is reflected by total milk collection. This was my BJ Medical College Milk Bank, which we started. But to be very sorry to say that in the beginning, the first 15 days after starting the milk bank was really a nightmare for me because of this 48-hour policy of discharge and because of the overcrowded PNC ward and because of lot of misconceptions and not knowing many things, people were not ready to come and donate the milk. Even if the mother was convinced somehow, the mother-in-law, the relatives, they will say that no, it should not be given. Why you want to donate your milk? They used to ask for discharge value. So after this milk bank was inaugurated, my dean called me within 3 days and asked me that Dr. Sandhya madam, what is the milk collection? Could you collect around 500 to 1000 liters? He asked. And I just said, sir, I have not started a Parsi dairy. It's a human milk bank. So not even 70 to 100 ml I have collected. So he was very upset. He was an orthopedician. So he said that, oh, madam, why so much of this thing done for this much milk? What is this? And all. So we all were very depressed, whoever we started the milk bank with so much of enthusiasm. And then we thought about that, what can be the solution for this? Next slide. In government also, they are funded through donors and there is no one-time donation is there. There is no support from the government for all this maintenance of equipments, procurement of materials and all those things. These are all not there. This was also one of the problem. So nowadays, when we say that you want to put the budget for the milk bank, you just see to it that you put everything because cleaning materials like detergents, dishwashing liquids, there is no streamlined purchase procedures for these things in place in the government setup. And so materials which are procured in government for cleaning all this, that is all very low quality and they cannot be used for cleaning the utensils of the milk bank or cleaning the flooring or glass panes, etc. because they have to be used, we have to use either Vim cleaning liquid or your choline, etc. we have to use for cleaning. So that is not available. So in the budget we have to give. Otherwise, it's a very great problem. Next slide. In most of the HMBs, there is no dedicated staff specially appointed for working in HMB. It is managed by the staff working in NICU or the PNC ward, and they are always overburdened. So quality is compromised. Only Rajasthan, Tamil Nadu, they have a sanctioned staff. Rajasthan, they have around 11 staff dedicated specially for milk bank. And they are not doing any other job, either it is a OBGY or a pediatric person, but they are there in the milk bank. Staff sisters are there, data entry operator is there, everybody is there. So this is something which is very important. The staff needs to be sanctioned. We had a huge problem because some of our NICU and PNC ward staff, they were very committed and then they used to work for us. But then in the hospital, the matron used to change the staff most of the time. So the staff who is trained, who is passionately doing the collection, immediately she will be put in some other unit and new staff will come who will not be sensitized at all. And then once again, the collection will drop and there will be problem. So very important for all of you to note that once if you have trained the staff for working in milk bank, they should be retained there only and they should be utilized for that purpose. That is something which we have to very much impress upon. We have to tell the matron, and we used to make lot of bargain and lot of discussion with matron about this staff, and we really used to have a hell of a problem. Then, of course, trained lactation counselor for sensitizing the mothers should be provided and must be available as such. Next. The hospital discharge policy of 48 hours makes the milk collection somewhat very difficult. In the initial 2 days, secretions are less, and most of the donors who donate milk in the milk banks, which is adjacent to the NICU, these are the NICU mothers. And because their preterm is there inside, and so excess milk they are expressing, and that they are donating, and this milk is utilized by NICU only. You cannot give it to others. Rajasthan government, they have made a very good policy of discharging the mother only after she is fit and confident to feed the baby. So if she wants to remain in the hospital for 7 days, 10 days, she can be there. There is no discharge policy that immediately discharges. So this particular aspect, even when you are starting, the Kerala government should take into account and bring this particular policy that unless and until the mother is totally confident, she should not be discharged. So we have only cross-sectional donors. Longitudinal donation is not yet practiced in India. Even home-based collection also is not very common in India. Next. Milk collection from immunization center, follow-up clinic, etc. That is usually less because once the mother is discharged from the hospital, again expecting her to come back and donate when she's coming for immunization or when she's coming for the follow-up, that is the biggest problem because most of the time the woman comes for delivery to her maternal place. The moment she is discharged and she rests for some days, she goes back to her husband's place. So then she will not come to this hospital. She might be in different town. And then we don't have any follow-up of her and no question of any donation. Next slide. Now, this concept of milk collection and community wise, how to collect the milk, because I had this problem in BJ Medical College where initially we had very less collection. And so I was invited in Seattle to make the global guidelines for human milk banking as a country representative from India way back in 2012. And there in Seattle, some of the countries, they came out with this particular idea of milk van, that all the house to house they go, they ask the mother to express the milk, collect it and bring it to the regional milk bank where they pool it, they pasteurize it, and then whoever wants, the beneficiary has to give a ring and then they will transport that milk to them. So this facility is there in few of the countries, but this van, I just got an idea that I think I should also have a van like this so that some collection, our amount, our donation will increase. Next slide. So thinking about that, once again, when I came back to Pune, I started searching for the donor to give me a vehicle for making it a milk collection van. So this again was a marathon exercise. Whomever I used to speak, I used to meet, they used to laugh at me and tell that, madam, what is this? We have heard for ambulances, we can give for cardiac ambulance, we can give for other things. What is this particular concept you are having and how it will work? So most of them used to listen, but they never entertain. But somehow, as your efforts, if you take, nothing is wasted. So one Rotarian from Pune Rotary Club, he came forward, he got idea, appreciated this, and he told that, madam, just give us a proposal and we will give you a van, which vehicle you want. So that time, this force vehicle was standing in front of my department because it had just brought some equipment. And so it was standing. So I said that I want a vehicle of this type and for milk collection in the community. So that Rotary people, all they called us for further negotiation and everything. And we got the donation of 30 lakhs way back in 2015. And we got this particular van. But then what to do and how to go about for collection to community, how the things will run. So with this, of course, this is the first human milk collection van which is present at BJ Medical College, Pune, inaugurated on 1st of August 2016. The one of its kind in India. Nowhere this vehicle is there. You cannot receive a second quotation also, how it is to be made. And this received BMJ Award for Best Maternal and Child Health Practices. The inside of the van is like this. Next. For initial 2 days, once we got this vehicle, my department, we shifted our pediatric and we became engineers. We thought about planning how to fabricate it, how to make it comfortable for collection of the milk. And my team at BJ Medical College, literally we burned nightmare oil. We did so much of exercise. Research we did, but we could not get much of the things because nowhere these things were existing. This is all our own ideas, thinking one after another, and we have designed this particular van. Next slide. To begin with, it was like this, and then we thought that we will be going, so we should have a space for sitting. There should be a refrigerator inside the van. There should be some cover, and there should be sheet. There should be a cradle, so that the small baby the mother has, she will keep and then she will donate the milk. Next slide. Then it should be ambient, it should be clean. There should be hand washing facility in the van inside. So this wash basin was attached with all the sterilium part, and then good comfortable chair for the mother, because we plan to go to the community, but in the house we cannot connect because they all live in very shanties. So it's very difficult for doing the collection over there. So she should come inside the van, and so one by one, and she should feel comfortable. So this van was AC, but then when the van will be stopping, that time the AC may not function, or we will be unnecessarily wasting our diesel and petrol. And so one small fan has to work over there. So everything we decided one by one to make the donor mother happier and quite comfortable to donate. Next slide. For the baby, we kept a cradle so that once the baby is sleeping, the mother can just donate. This is the mother who is there very happily donating from the breast milk pump inside our milk van. And baby is happy to rest and doctor is very happy to counsel. So in BJ Medical College, our team used to go, our resident doctors, our interns, all they were very happy and they were all very ready to go out of the campus. We used to have 30-kilometer distance only, they told that you can take the van, because van was donated, but the diesel petrol was not given. The government said we don't have any provision to provide diesel for you for this particular purpose. And so we cannot give you beyond 30 kilometers. And so we used to select all those mothers who are there in that particular area. And then we used to go, take the van, go there and collect the milk, bring it to our milk bank, pasteurize it. And this way, our milk collection rapidly increased. Next slide. My team, Dr. Chaya Valvi, Dr. Uday Rajput, Dr. Rajesh Kulkarni, they all helped me a lot for this particular van. And we made this van so that in the hospital, in government, anytime if you bring any vehicle, the dean will utilize it for most of the time. And so they should not, the vehicle should not go out. So for that reason, This is the lady in the van. She is the NICU mother who has donated the milk. So we took her photo, we took her permission, affidavit we made, pasted her, and with all this milk collection van and everything, nobody uses this van except only for milk collection. It is there. Anybody you happen to go to BJ, surely go and see this van, and you will be very happy to see all the arrangements which are there. Next slide. There are many psychosociological issues also which the mother faces, and maternal motivation and willingness to donate breast milk. We have faced many problems. Women at either end of the reproductive age with higher parity, they are most often very much reluctant to donate. Limited awareness, misconceptions by powerful influences of the family that donating milk may hamper milk supply of the infant. That is a major concern. So passionate counseling is required to donate and motivate them for donation. Lot of misconceptions are there. The kinship issue, which is very, very important. This happened in Bangladesh, though we started with a great hue and cry, but then the leaders, religious leaders, stopped that milk ban because if two Sikhs receive the milk from the same mother, then they are brother and sister and they cannot get married in the long term. So this particular kinship consequences which are there, that hampers milk bank in many of the communities and regional places. Bangladesh milk bank not functioning to that extent at all. There are concerns about safety standards also by some, like though we do the testing regularly for HIV, Australia antigen and VDRL, mother if she is in window period and then if something goes wrong, so that particular aspect we take a consent, that's all, from the mother, that I am ready to donate and I am ready to visit. But till date, in my experience, I have not faced any problem of this HIV window period, etc. Testing for HCV, HTLV is guidelines as per the abroad guidelines. It is all compulsory. In our country, we don't have that much incidences. So our national guidelines also given these two as optional. Next slide. Very important is a close hand-holding and coordination between the microbiology, pediatrics, neonatology, and OB/GYN for successful running of the milk bank. These departments have to come together. Most of the time, the pediatrics and the OB/GYN department are at loggerheads with each other. So then very difficult to start the milk bank. There has to be very much hand-holding. Frequent transfers of the government officers, that also create many problems. When you start in the private, I have the experience of working in government, in corporation, as well as in private medical college. In private, there is a leadership issues, management issues, ego problems are there, management related problems are there, lot of priority issues are there because the milk bank will not generate any revenue for the private institute. And they are all always thinking about what is the point if I start this particular facility, what am I going to get? With milk bank, you cannot accept that some revenue will be generated, and that is the biggest problem for starting a human milk bank in private medical colleges. Again, lot of deliveries and patients, that is again the second point. Work culture may interfere with the functioning of the milk bank needs. As most of the milk banks are through donors, there is no sanctioned budget at place in the system. The cost and the expenditure incurred by, if it is given by the government of Maharashtra, Tamil Nadu, etc., they have given a budget in SNCU, they have provided it, but not everywhere. The cost and expenditure incurred by all the department also is not worked. Like for example, working for HMB in a hospital be approved, like the microbiology department, for them, they have to use continuously the culture plates. So the provision for those culture plates in their budget has to be made. Otherwise, not many problems. In one of the milk bank which was started in Nagpur, the culture plates were not available, microbiology refused to give, and the donated milk got wasted. Again, OB/GYN department, we used to face the problem, like when we asked for the gowns for mother, then the OBGYN department people will say, now we cannot give for her entering into the milk bank and all. So forget about it. You intend your own cows. And like that, so many things, day-to-day problem, we have to sort it out, ask for that, going to the management daily, going to the administration daily. But that work is very important. And when a baby gets a milk from the human milk bank and it grows nicely and discharged, that is one feeling which really made me do all this job. I now remember that wherever, how many times, which place I have gone for begging to give this to them, to give that to them. Again, when the mother is donating the milk, she becomes tired. We need to give her something, some nutritious diet. Most of the time in the hospital, after the milk donation, immediately nothing is provided. Then I had to go to the kitchen, tell them to supply something, and then they came forward. And we used to give in BJ Medical College 80 grams of chikki, which contains coconut and all this dry fruits and everything. Some chikki was made, and that one chikki mother used to get after donating the milk, and 1 glass of milk she used to get. And sometime, because of all this eatables which we were giving to her, few mothers used to come forward and donate and get relaxed and have a good diet also. Next slide. Very important is to make people understand, particularly the administrative authorities, public representatives, that milk from the human milk bank is just a stopgap arrangement, and baby should always receive mother's own milk. That is something which is very, very important. From the beginning, you have to tell. We have the problem because this milk bank, when inaugural function is there, we invite certain ministers, corporators and all. They come and they learn about that. And then immediately next day, I got a call from the corporator that my daughter-in-law wants to watch a movie along with her husband. So send some human milk to my home to feed the baby. When mother is ready, when she is available, how can we give it to for this baby? But they don't understand. So these things have to be told right in the inaugural function itself, that this is a stopgap arrangement. Nobody will get if the mother is feeding the baby. These problems are faced in corporation, government, private, and pressures for providing human milk to orphanages. See, first of all, it is the hospital in-house NICU where you can provide the milk. If your collection is over and above, then you can give it to orphanage. But to an orphan, one day you cannot provide. You have to provide at least for 6 months. So if your collection and donation is that, then you can always give. Otherwise, never ever commit to any orphanages that you will provide the milk from the human milk bank. Even donors, we should not say, because many people, for asking the donation, they say that it will be helpful to orphanage and all, and then afterwards we are not in a position to give them. Next, there are certain legal aspect, guidelines, regulations. We have NICE guidelines, national guidelines is there by IAP and PATH. The revised guidelines are shortly going to come in the IAP. We have Hambana guidelines, Italian Association, Norway, Australia, and country-specific guidelines are available. Now everybody can look out by the guidelines, and point by point they can start their own human milk bank. There is no issues. Next. But there is no legislation or regulation for HMB in India. It's of course a very felt need. With around 118 milk banks in our country, we should have a regulation, because all the milk banks which are functioning in various states, either by government or by donation, whatever it is, there is no control and there is no regulation. Everybody is following their own system and they have their own practices. And there is no system available for accreditation or validation of the human milk banks. Even monitoring of the human milk bank by any one particular authority is not there anywhere, neither in Maharashtra or in any government, where you are monitoring actually what's happening. There is no regulatory authority. Of course, we have told this in the NNF forum, in the IAP forum. Some letters have been drafted, but till date, we do not have any regulation. Next slide. Main question is, what is human milk? Is it a tissue fluid? Is it a nutritive supplement? Is it a medicine? If it is a tissue fluid, as it is a secretion of the mammary gland, then it has to have an FDA approval. If it is a nutritive supplement, then no FDA approval is required. Whether it is a medicine, because it saves the life of the neonate. Next slide. Quality assurance, again, very important. Hazard analysis, critical control points we have to do. Safety has to be addressed through analysis and control of biological, chemical, and physical hazards. Tracking of donor milk from single mother, very difficult task. Always we pool the milk collection. Again, it becomes very difficult to track the mother to whom the milk belongs. PATH has created a module for the workshop and training in quality assurance. But however, many of the milk bank staff, they are not trained. Next slide. In government setup, milk from the human milk bank is given free. We don't charge anything. In private setup, recurrent expenditure, some of the milk banks to maintain that they are charging. Some hospitals are charging very nominal charges because they want for their diesel, vehicle collection, maintenance of the equipments and all. But because there is no regulatory authority, some of the hospitals, private hospitals who have started the milk bank, they are at times charging exorbitant price. Now companies are coming and they are proclaiming like Neolacta that for 1,500 rupees, they give around 30 ml, which is actually very exorbitant cost. Use of human milk other than feeding babies. This is one more acute problem which is coming up because of the properties of the colostrum for cosmetics as an immune booster, which is a dangerous erupting practice. Here we want legislation urgently, and this is happening. Next slide. This bodybuilder, JJ Retinure, attributes the reason behind doing so to get the best nutrition, explaining that eating like a growing baby will help him get fit. This weird idea he has got, and it is encouraged, and misuse of human milk is going on. Recently, Dr. Sushma Nandia's article has been the citation, best citation for all these facts which she has mentioned in the article. I've yet to read that particular article, but I'll request all of you to go through commercialization of the misuse of human milk. That is something which has to be stopped, and everybody has to be rest assured that the milk bank practices all ethics, and the milk from the milk bank is only for the newborn baby for which it is made. Next slide. So many problems, of course. I told you the journey was not at all simple. Every day some problem will arise, and then we will sort it out, we will solve it, and one by one, we started so many milk banks. My dream, my mission, vision, everything is that every hospital where there is a delivery, where there is a maternal and child health setup should have a human milk bank to take care of the baby till the mother is totally fit to feed the baby. If biological mother by any chance is not available to feed her own baby, milk bank has to come immediately as a stopgap arrangement, that's all, to take care of that baby, so that under no circumstances the baby should receive any milk other than the human milk. It should be only human milk, if not of its own mother, at least from another mother. So take one step in the direction of your dreams and watch the universe perform miracles to help you. To me, a lot of miracles have happened. Many people have come as angel in distress to help me for everything in the milk bank. So I never say that I faced problems, but I enjoyed actually, even till date, today also, whenever anybody asks to talk about milk bank or my experience about milk bank, I enjoy like anything. Today, I have attended the executive council meeting for almost 4 hours in the university, and whole day I was busy. But with great passion and interest, I have come back to you to tell you about my experience. I hope you all would learn something, and my best wishes to all the people in Kerala to start as many milk banks as possible. I assure you my full support, cooperation, guidance. Whenever you need me for any training purpose, I will come on my own and train all your staff. Whoever is there, you are going to start in Trivandrum, you are going to start in Kottayam, call me in any place. I will be there at your doorstep with my own funding. You need not spend a single pie for me, but I will train your staff, I will train your entire team and see that one milk bank functions in the best possible way. With this, thank you once again, IAP Kerala, entire team, for giving me this particular opportunity. I'm overwhelmed with all the words showered about me, and thank you all once again. Thanks a lot.
Thank you.
Thank you,
madam.
madam. Thank you
Thank
very
you so
much,
much.
madam. Dr. Yes, please.
So I think I would like one or two persons to give their comments. Our Elizabeth madam has joined. First, we will listen to ma'am, and then also to Bindu madam. Bindu madam is the superintendent of SAT, where madam is trying to establish a branch. So first, Elizabeth madam, over to ma'am.
I'm really spellbound. Dr. Sandhya's commitment and passion, I really appreciate. I know her so personally, and we have worked together. And I'm really ashamed that we are in the forefront for many things, but we are behind in this. The Calicut model we can easily follow. There we had lot of apprehension because Calicut is a very place where religious certain communities are more like that. Whether they'll ask whether whose milk you are giving, is it from the same religion? But Calicut had the best acceptance. So I am sure that there will not be any problem in other of parts if Calicut can accept it so well. And even they were telling we are collecting lot of milk. At least 30% of our women who are working in the hospital, maybe they are doctors, PGs, students, nurses, attenders, even the police chechi in the aid post, they call them. All of them are willing to donate because they are all going, because they are all lactating. And when they feel about their baby, their breast become full and they have let down, they say, and if they can donate, why not we donate? So all of them are coming and donating, and it has become a big success there, and they call it Loud Drops. And in the government sector, we have in Calicut Medical College, now Thrissur Medical College has started. Then was this all mentioned? I don't know. I joined a little late. Then Ernakulam Medical College, then private sector, Mother's Hospital, I think in Thrissur. So we have models where we can go. And even Dr. Srinivasan sir from Chennai was telling that he only helped the Calicut team to procure all the equipments and all. And he is also willing to come and help us. And ma'am has offered an unconditional love and her commitment to start one in Trivandrum. And I earnestly hope that we will be able to do it soon. Space was a big problem for us. I understand from Dr. Radhika that now space is also provided, and there are a lot of NGOs or Rotarians, Inner Wheel, all these are there, Lions Club, and even we have the Techno Park here, no? IT professionals. So they can all give us money. Money is not a problem at all. I think we should have regional breast milk banks. And now I am proudly saying that I am working in Tamil Nadu, and out of the 38 districts, 32 have breast milk bank. So that is a big model, I can say now. And Dr. Srinivasan sir, JM madam's assistants, Dr. Kumudam, and all of them are there, so much working. And here we have committed people, and we know MOM, Mother's Own Milk. If that is not there, PDHM, where is it coming from? Nobody has an idea. That should not happen. And the title also I enjoyed. Madam, thank you so much.
Thank you.
For coming and sharing your great personal experience to our
Thank you very much, ma'am. Thank you.
august audience. Thank you very much.
Thank you, madam. Bindu madam, Superintendent of SAT Hospital.
ഹലോ കേൾക്കാമോ?
Yes, madam. കേൾക്കാം. പറഞ്ഞോളൂ, madam.
Madam Sandhya madam, I have heard your talk, and we are very much we are honored with your class, ma'am, IAP and also SAT Hospital. And Elizabeth, ma'am, now we are in we have completed the construction almost full, and we are yet to start the breast milk in SAT Hospital, madam. And some of the equipments only we have to receive. All the staffs, trained personnels, all are available, ma'am. Definitely, we will start the breast milk bank. I think within few months we can start our breast milk bank in SAT Hospital, madam. And it will be because I have heard Elizabeth madams, because if madam were there, I think it will be more easy. But we have tried a lot to make up the space, and Riaz also know that how it was very difficult to find
Space.
out that space. Always
Now
it
I
is
heard
very
that you have space, so
yeah,
we are
ma'am. It is there. We have allotted the space, and NHM has given a lot of fund, and the civil work and all this already completed, and some of the equipments we got, and some of the consumables are also in the pipeline, and we will ready to start, ma'am. Definitely, we will start within few months, and that will be a support for most of the mothers. And as madam said, so many lactating mothers are there in and around our hospital, and our own patients, they are staying for a long time in SAT Hospital, especially Radhia knows the preterm babies, they are staying in the hospital for many months. So the availability of the breast milk is not a problem. And Sandhya madam said whether we should charge or we should get money from breast milk. I don't think so in the beginning, because in the government sector, that should be a policy decision. And first of all, we have to start it, and that should be in a good function. And then only we can think about the payment or something else. I think it should be free, I think, in my opinion. But I don't know whether we can pull through without any payment, because of most of the consumables and other charges we have to met in the government sector. The money and the expenditure is a problem for us. Okay, definitely, Madam Sandhya ma'am and Elizabeth ma'am, definitely we will, Trivandrum SAT will start the breast milk bank within few months. I think so. We are behind it. Our our newborn unit, Dr. Radhika and Ashwati, all are trained with it, and Ashwati has visited the Calicut center to see the civil work and how they are using it. All these are on the way, and we are ready to start, ma'am.
Sure.
Okay, thank you, Bindu madam. And one day we will invite Sandhya madam to SAT Hospital.
Yeah, definitely, ma'am. We are expecting your valuable presence. We will be honored, SAT, because this much of dedicated person. The communities, the people, our mothers are very much. The young generation should see the this type of commitment from your side, ma'am. That is the message to the young generation. Welcome, ma'am. Welcome to the SAT Hospital.
Sure.
Thank you so much. Srinivasan sir, few words.
Which Srinivasan? Because, yeah. So, of course, breast milk bank is an essential commodity nowadays. And of course, regarding the milk banking, of course, is now coming up in a big way in many states. I'm sure, when Madam told that in Kerala number is less, I was surprised because I was, in one of the panel discussions in 62nd conference, IAP conference. So I was collecting data from various states. So I was really surprised because, Ernakulam and Cochin being the first baby friendly district, how it was like that. Now I'm happy that to know that you are taking so much of efforts to bring in more milk banks. So it's very good effort, and of course, the I have been a regular examiner with Armida Fernandez, and I knew about her commitment and how she started, etc. Such a wonderful woman, and of course, Sandhya Katse is no less, because her commitment also I've been watching for so many years now. So wish you all the best. Yeah. Thank you.
Thank you, sir. Any doubts from the delegates? One or two doubts? Okay.
Regarding the one point I wanted to make, this thing, no, in Chennai, what happened is when money was being given, so people were not giving to their own children and then selling it. That was the only drawback, that created a sort of this thing, concern. And that has to be overcome. They should give to their children and then give the extra milk to this
Yes.
thing. Yeah.
Mm. Okay. Sajida? Sajida? Okay. So, vote of thanks. Now let me thank Sandhya Madam for sharing her huge knowledge on human milk banking. It was truly inspiring, Madam, and I sincerely hope Kerala will start more human milk banks soon. I thank Dr. Riaz, Dr. Gopi, Dr. Bedukutan, the IIP Kerala office bearers for their wholehearted support, and I thank Dr. Praveed for his illustrious flyer. I thank Dr. Rahul, the State Nodal Officer, for help for attending this program and giving valuable inputs. I also thank Bindu S. Madam, who is the Superintendent of SAT Hospital, Government Medical College, Trivandrum, for her valuable inputs. And I thank all the senior teachers, Srinivasan sir, senior pediatricians, friends, and students for attending this program and making it a huge success. Thank you very much. This program is recorded and will be available soon. Thank you. Thank you, Madam.
Thank
Thank
you.
you all.
Thank you.
Thank you. Good night. Good night.
Good
Good
night.
night, all of you.
Thank you, ma'am. Thank you.
Thank you.
Thank you, madam.
Thank you.
Thank you.